Every 10th of October is World Mental Health Day. Everywhere in the world, people are talking about mental health. So this is our chance on this program to talk about mental health. Every human walks on two legs. You cannot stand if one is missing. And so is our health. Our health is supported on three legs. If one is missing, we are not healthy. These three legs are physical health, social health, and mental health. Mental health is commonly ignored, but there is no health without mental health. So that is why health is said to be a state of complete well-being, physical, social, and mental well-being, and not just the absence of disease or infirmity. So if somebody is not physically sick, but they are mentally, troubled, then they are not healthy. Of course, all of us have mental health concerns from time to time. You may wake up feeling low. You may be unhappy. But you go to work and come back, you feel better. Or it is lasting 1 or 2 days and you are telling yourself, Madam, calm down. And you snap out of it. When they don't linger, we say they are mental health concerns. But when they linger and they make that person not to be able to function, then that person has not just a mental health concern, but a mental health disorder. In mental health disorders, there is possibility of overlooking them because it is either the signs are not visible to people around. It is just that person that has that inner struggle, or that person kills himself before people say, oh, he had the signs. So sometimes the signs are there. People miss the signs. And sometimes people don't miss the signs, but they misinterpret the signs. I'll give you an example. A family woman who has been good with her family suddenly changed, and then she was nagging. She started nagging seriously, and then cursing her children, being very, very hostile to them. She beat the children. Then the husband left home, concluded that he could no longer live with her, and left home. In time, all the children also abandoned her, and so she started living alone in the big house. It took the intervention of a friend of hers to take her to the hospital because she recognized that she was having a mental health condition. But her family members failed to recognize that it was a mental health condition. So they saw the signs, but they misinterpreted it, that she just became difficult. And so instead of seeking help medically, they just abandoned her. A 21-year-old lady visited my clinic one day and said, Doctor, how can I kill myself? She was in company of another person. And I said, why are you thinking of death? Throughout the period we were talking, the only thing that kept coming up was, how can I kill myself? So for that kind of a person, she was dealing with depression. So if anybody ever asks you, how can I kill myself? Or what is the best way to die? Please take it seriously and help them. They might be dealing with depression. In the case of this lady, she lacked nothing. She was a beautiful lady and well cared for. Her parents had everything, but yet she wanted to kill herself. So we didn't allow her to go home. We admitted her because if she went home, she might, harm herself and succeed at it. So what are other signs to watch out for in depression? The person that has depression keeps having persistent sadness, hopelessness, loss of interest in things that normally interest them. Maybe they like cooking, but suddenly it doesn't interest them in any way. And then changes in appetite. Is it that they are eating too much or they are starving? Or fatigue. They wake up in the morning, they have low energy, they cannot even get out of bed. Or difficulty concentrating. And in the extreme cases, like in the lady I told you about, thoughts of suicide. Sometimes it might be a woman who just puts to bed and you expect them to be happy. Not that there is paternity dispute, it is their husband that is the father of their baby, but they are sad. They cannot get out of bed. They don't even like the baby. They are not feeding the baby. The baby is crying, they are not responding. And if there's nobody at home, they might harm the baby because thoughts of hurting the baby keeps coming to their minds. and they can harm themselves also. These people have postpartum depression and they should be helped. Let's go to anxiety. Sometimes a person is anxious, and in their anxiety, they have extreme fear and worries. Sometimes they are restless, they have difficulty concentrating, sleep disturbance, and they have palpitation. Their heart starts beating fast. Sometimes they are trembling or sweaty. If you know the object of that fear, then it is called phobic anxiety disorder. It could be fear of height. If you take them to a high place, they're afraid. Or you take them to near the ocean, they cannot even open their eyes, they're holding on to somebody. That is phobic anxiety. But sometimes you don't even know the object of that fear. It is, you are just afraid generally. And it is crippling you. Some are so afraid that they cannot go out of the house. In that case, that person has generalized anxiety disorder. Please let them see a doctor. But sometimes people, move between depression and happiness, mood swings. We call it bipolar affective disorder. In bipolar affective disorder, the person is having mood swings, like I said, and they have increased energy, sometimes agitation, and sometimes there are racing thoughts going through their minds. They have poor judgment and they have reckless behavior. They may be so unusually generous. They can get their salary and give everything out. A lady once told me what she did with all her properties. She gave them out, including the bed she sleeps on and her cooking utensils. Her neighbors thought she was moving out. So they asked her and she said no, because she was giving them out at the moment when they found out. So they helped her retrieve everything back. Some, they dress in such a flashy manner that you are wondering, how can you combine these colors? That person may be having mania. And in the other extreme, they become very sad. Sometimes when they remember all the things that they have done during the manic phase, they become extremely sad. So when people fluctuate like that between moods, they have bipolar affective disorder and they should be helped. What of post-traumatic stress disorder? Well, as a child, there was a time that I experienced armed robbery. I did not see them face to face, but I was hearing their voices. And they were throwing things, at all the apartments while they entered some of the apartments. So thereafter, when I go out and I see gentlemen, perfectly gentlemen going on the road, I'll be afraid. I'll be afraid like they were coming to attack me. Yes, so in post-traumatic stress disorder, something has happened that is traumatic for you. But then you have flashbacks and nightmares. Sometimes you want to avoid the triggers like a plague, or there is hypervigilance, exaggerated startle response. Just hear a loud voice and then you are extremely startled, or difficulty sleeping, anger, irritability, guilt, shame, and all that. Maybe in rape, the person is ashamed, cannot even go on the street. You feel like, everybody knows about their story and all that. That is post-traumatic stress disorder. If somebody has it, it can cripple them. Not cripple in the physical sense, but they are not able to function. So please take them to the hospital. Let's talk about OCD, obsessive compulsive disorder. There was a lady who cried out sometime in the past and said, please help me. My fiancé bathes about 10 times a day and encourages me to do the same. When she asks him why, he will say, germs are everywhere. That's true, germs are everywhere, but does that mean that we should bathe 10 times? And the brother will be cleaning the handle of the door 10 times, repeatedly. He has not gone out, nobody has come in. He's the only one inside, and then he will be cleaning every hour, cleaning the handle of the door. For God's sake, that is not normal. That is obsessive compulsive disorder. What are other signs you see in obsessive compulsive disorder? They are preoccupied with symmetry. If you fold clothes for them, the edges are not perfectly touching. You have not folded it. They will unfold it and fold it by themselves. If you arrange something in their wardrobe, it is not perfectly, arranged. They will remove everything and start all over again. They have fear of contamination or fear of harm, and they have repetitive checking. They have locked the door and they have checked. They'll go and check again. They can check repeatedly until maybe they will even sit down by the door and say, I'm not going again, because They have been checking and yet they are not convinced that the door is really locked. That is OCD. Such a person needs help. To the outside person, they are neat, but to the person who is living with them, you know that they cannot function. They are preoccupied, extremely preoccupied with that compulsive behavior. What of schizophrenia? In schizophrenia, a lady that had schizophrenia was a nice person in the neighborhood, known as a nice person in the neighborhood. But suddenly when her schizophrenia started, she started, being suspicious of everybody. She thought they wanted to poison her. The people of her compound wanted to kill her. And so she started locking her door, fighting with everybody, picking quarrels with everybody in the compound and cursing them. She thought that they were listening to her conversation. They were planting cameras in her apartment and watching her. And then she was hearing voices. When such persons hear voices, you say they have hallucination. It can be auditory, they are hearing voices. And it can be visual, they are seeing things that are not real. But when this happens, sometimes they respond to the voices. And that is when you see people talk to themselves. This is schizophrenia. If you see this sign, please help such people that are battling with it. Let's talk about yet another one. Those that have dementia. There is a grandma that has been forgetting things lately in the past 4 to 6 months. And she will say her children and grandchildren have picked her stuffs. And they'll say, Grandma, we did not pick your belongings. She'll say, you picked them. Grandma will eat in the morning. She'll say she has not eaten anything. Because she forgot. Not because she was being wicked. She had forgotten. Grandma will unpack everything in her wardrobe. She's looking for things. She will continue to search for things and arrange and rearrange, and it is wearing her out. She is in distress because of the stress she's putting herself through. And when this happens, think dementia. Dementia in the extreme case also has other symptoms. For example, they may not be able to trace the home back. If they go out on their own, they may not be able to find their way back home. So you don't allow them to go out on their own. Also, sometimes they may not be able to do self-care. They may not know where the toilet is, how to get to the toilet, how to bathe themselves, and all that. That is dementia. They need help. Let's talk about substance use disorder, especially in adolescents or teenagers. When you see a teenager who was, a happy child before, suddenly become withdrawn. Nobody is bullying them, but yet they are withdrawn. Then they might be doing drugs. They might avoid, visual gaze. When your eyes are about to meet during a conversation, they change their gaze. They don't want to look at your eyes. Sometimes their grades drop. They are not doing well in school again. Somebody that was doing well before now starts failing their exams. They have friends, they don't want their family members, their parents, to meet their new friends. That child might have started taking illegal drugs. So why not, assist them? I believe the message is passed, even though it is a broad topic, but I have tried to narrow it down. But if you see anybody who has some symptoms that you feel might be related to mental health conditions, then please assist them. Rather than call them names, please suggest to them that they should see a doctor. They should see preferably a psychiatrist. But if they don't want to see a psychiatrist, they can see a general physician, and they can also see a clinical psychologist. Clinical psychologists use talk therapy to assist people with mental health conditions. All of us should pay attention to our mental health, because without mental health, health is not complete. Thank you so much for watching. I'm Dr. Abosede Adegbite of Clinic Annex. And if you have any topic that you want me to discuss, you can put them in the comment section or on the WhatsApp number showing on your screen. I would like to use your topics and your requests to make videos. And do not forget to subscribe, share it with everybody, and give us a thumbs up. Until next week, when I come your way again, God willing, good health is great wealth, including what? Mental health. Bye for now.